We need to talk about the case of Texas Congresswoman Bernice Johnson, who passed away New Year's Eve at the age of 89 from complications related to osteomyelitis. She was the first registered nurse elected to Congress. Huge, major accomplishment. Her son, an attorney, just gave a press conference in which they are alleging medical neglect. And to me, it sounds like they're prepping it to go after the nurses. I'm going to play a couple of clips for you. You tell me what you think. They have to give a 60-day requisite notice, so there has not been a lawsuit filed yet for me to check who's being named, but you listen to it and tell me what you think. And there's a bigger issue, and the nurses will immediately recognize it when you watch these clips. But a little bit of background. September 11th, 2023, she went into Baylor Scott & White in Texas for scheduled lumbar surgery related to stenosis, spondylosis, scoliosis. She was then at Baylor Institute of Rehab post-op. The allegations are that she called for help with her call light, that she was unattended for about an hour, that she was left in her own feces, that this saturated the surgical dressing, which ultimately led to osteomyelitis. She was eventually transferred to a SNF and then placed on hospice on December 20th, passed away New Year's Eve. Take a look at these clips.
And when I got there, she was still in that same condition. We waited. I pressed the button. No one responded. So at that point, I left and went out to the nursing station, and there was no one there. A few minutes later, I finally was approached by a young lady. I can't give you her name, but she had on a Baylor smock. And she went and found some of the nurses and came back and told them that they were in training and that they would be out shortly. It was at that point I said, I need to speak with someone else. And I was directed to the administrative office on the first floor of the facility. And I told him and asked him, would he accompany me to see what her condition smelled.
Did I understand you to say that the nurses had indicated to you that they were in training at that time? Is that what their issue was, why they weren't present in the room?
That's what I was told on that day. I have no idea what they were really doing.
They weren't there. They weren't on the floor. He couldn't find any of them on the floor, and he was subsequently told they were all in a training session. And as you heard from the tape recording from the case manager that called and left the voicemail, she said that the tech was in another room. So, I mean, basically nobody was there, and Congresswoman was abandoned.
Can you clarify something, please? I keep hearing nurses weren't there. It's the techs that take care of the patients, not the nurses, correct?
Both, tech and nurse. So there should be both tech and a nurse available in there, particularly when she's hitting the call button. That goes to the nurse. No nurse responded.
Well, it goes to a desk, and the desk assigns it. And there wasn't anyone at the desk?
Correct. It goes to a desk where a nurse is sitting.
I hope that this video makes its way to Congresswoman's son and attorney, and I am very, very sorry for your loss. And she was absolutely an asset to the nursing community and to the political community. However, let me be entirely clear. Nurses are forced to attend trainings and all manner of things while simultaneously having a full patient assignment. We hate this. We complain about this all the time. Unions have things in their contracts to prevent this sometimes. This is a prolific issue all over the place. It's certainly not specific to Baylor Scott & White. Nurses don't want to leave the unit or the floor, but we're forced to all the time to transport patients because they don't want to pay for transporters. And I'm not talking even about like critical ICU patients, like any patients. They make the nurse take them down to CAT scan and wait there for an hour while their 6 other patients are left unattended, that kind of thing. They don't want to pay for us to come in on our day off or to stay late and accrue any kind of overtime to attend these mandatory training sessions. They don't want to pay us. I guarantee you this is a hospital's greed behind the nurses being in a training session and not on the floor. We express safety concerns about these exact kind of situations taking place all the time. So while I can't tell who you're going after because there isn't a lawsuit yet, it seems clear to me in the way that you spoke that you seem to think it's the nurses or the tech's fault. I promise you, if they're not on the floor for a mandatory training session, that is Baylor, Scott, and White behind it, not the nurse. Go after where the greed is. Follow the money.